Hello, I am Pat Langworthy. I work for Lincoln Schools for the Grand Rapids Public School System. I am a teacher for students with ASD. Today I am going to review applied behavior analysis and their effects on students with autism. Applied behavior analysis, or ABA, started out with Dr. Ivar Lovaas doing studies in the 1960s and the 1970s. He had found that with students with autism, that some of them were treatable. He used the behaviorist approach from B.F. Skinner and Ivan Pavlov versus the medical approach of treating it as a neurosis, which was not getting effects that they would like to have with students. The attention was greatly increased within the nation to use ABA in 1987 when Dr. Ivan Lovaas published his paper. The model emphasized intensive repetition, 35 to 40 hours per week, with trained staff. Reinforcements were looked at and were used. Unfortunately, most people looked at them as punishments in the beginning. To determine whether the reinforcement is a punishment or a reinforcer or consequence, we need to state that if the behavior changes with the consequence or reinforcement, then it is a positive or a consequence. If it does not change, it becomes a punishment. The principles of ABA. The principles use the principles of learning and motivation, that all behavior is learned, all behavior serves a purpose, and all behavior is contextual. There are many varieties and techniques to be used for the procedures. Incorporation of verbal behavior can be using talking, writing, sign language, gestures, or augmentative devices. Function over form is the foundation of any ABA method. The principles to be considered when choosing for the student with autism are: teach each step separately, plan for reinforcement. To know which reinforcements work for the student, you need to observe many times, talk to the parents to find out what the mode of interest is that the student will respond to. Practice each step separately and repeatedly until completely independent. Collect data. The data will help us decide if the intervention is working or not working and when to change it. Generalize the task for skill development and independency. Methods most widely used are discrete trial training using the task analysis, incidental teaching, which uses naturalistic environment, verbal behavior, which incorporates using voice along with gestures, pivotal response training, natural language paradigm, prompting and fading. When using prompting and fading, we usually go from most prompts to least prompts and fade as the student gains the independency of the skill. Remember to always fade the prompt, not the reinforcement. Promote best practices programs to ensure to ensure that the method you are using for ABA is evidence-based, we need to make sure that it is tested for usefulness, quality, and effectiveness. The National Professional Development Center for ASD has set rigorous criteria to determine if a practice is evidence-based. Within their site of MPDC, they have tested infancy to 22-year-old students with autism with 24 different methods. There is a chart in there that determines whether or not the method will work or it has been effective within an age group. Successful adults with ASD learn life skills best when lessons are generalized, repeated many times, and taught in real-life situations. Two models that have been considered very good practices are the Denver model for early childhood development and the TEACH model. Individualized education plans need to use ABA methods. This is a necessity to understand how to write the goals and objectives. Trained personnel using ABA methods gives validity to the methods utilized. As you are researching and trying to find the best method possible for your students, you need to remember that many companies are proclaiming that they have new practices all the time. In order to ensure that it's an evidence-based practice, you need to use websites or references that give you that information. the START website on www.gvsu.edu, Autism Speaks, or the National Professional Development Center for Autism are sites that will give you this information. Recently, Michigan has passed the autism insurance legislation bills in March of 2012. This Senate Bill 414, 415, and 981 stated that students with autism or individuals with autism could get their insurances to pay for therapy, either behavior therapy, occupational therapy, speech therapy, or physical therapy. To know whether or not your insurance will qualify you, or which insurances do qualify, an individual with autism needs to check with their local Department of Community Health. Also, the Autism Alliance of Michigan has recently started offering ABA training so that we can have more trained individuals to give the behavior therapy. I hope you check out the websites and the references that I have mentioned. Thank you.